Diagnostic bacteriology, uh, we have to collect the sample. We have to collect the suitable clinical sample. And correctly mark it, the patient's name, age, sex, and any administration of antibiotic previously before sending the sample. It's very important to collect the sample. First is most common sample, which urine. Urine should be collected in a wide mouth bottle, and you should have patient's name, age, sex, IPOP number, and requisition carrying should have all the, whether it is catheterized or midstream sample of urine. The sample of urine should be collected. First few drops should be avoided. Only middle portion, small portion should be collected, and last portion should be discarded. It should be collected in the midstream sample of the urine and sent to the laboratory. So urinary tract infection. Prostate, bladder, ureter, kidney. Okay, kidney. So urinary tract infection is common in females compared to male because of short stature of urethra, proximity of the anal region to the urethral region. So urine should be collected, should be sent to the laboratory as early as possible. Urine should not be refrigerated. Urine, if there is a delay of more than 6 to 8 hours, it should be refrigerated. If it is immediately done, it should not be kept at room temperature because colony count will rise. The most commonly used medium is McConkey's medium. Now you have to do direct smear centrifuge sample, but small portion should be inoculated in the McConkey's medium, which we commonly use. So I already told you McConkey's medium consists of plant, P for peptone, L for lactose, A for agar, N for neutral red, T for taurocolate, T for taurocolate. So plant, mnemonic you remember plant, P for peptone, L for lactose, A for agar, N for neutral red, T for taurocolate. This taurocolate makes McConkey medium selective. It inhibits non-enteric organisms. It makes non. So remember the organism which with a mnemonic keeps. Okay. A for Klebsiella, E for E. coli, E for Enterobacter, and Blar enterococci, that is Streptococcus faecium or fecalis. Enterococci, Pseudomonas, proteus, and Cephalococcus, especially cons, coagulase negative Staphylococcus. These organisms cause Staphylococci. There is, we plate it onto the whole plate. So depending on the colony, they are classified into lactose fermenters and non-lactose. Lactose fermenters and non-lactose. Lactose fermenters because they ferment lactose. The colonies are pink. Colonies are pink in color. Non-lactose ferment do not ferment lactose. They are colorless or pale. Example of lactose fermenters are E. coli, Klebsiella. Example of lactose fermenters are E. coli and Klebsiella. Non-lactose fermenters are, remember, SSPP, 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 Salmonella, Shigella, Proteus, Pseudomonas. Salmonella, Shigella, Proteus and Pseudomonas. Salmonella, Shigella, Proteus and Pseudomonas. This mnemonic you remember? Klebsiella, E. coli, Enterobacter, Enterococci, Pseudomonas, Proteus, Staphylococci, coagulase negative Staphylococci. So these are the organism which causes enteric fever. McConkey's mnemonic you remember? Plant, peptone, lactose, agar, and Klebsiella, neutral red. Taurocolate bile salt is used to inhibit non-enteric organisms, and it gives rise to two types of colonies: so selective as well as differential lineage. Selective for enteric organism, differential to differentiate between lactose fermenters and non-lactose fermenters. Example of lactose fermenters are E. coli and Klebsiella. Non-lactose fermenters are SSPP, Salmonella, Shigella, Proteus, and Pseudomonas, non-lactose fermenters. Okay, now all these organisms, when you do a gram stain, all these organisms when you do gram stain, of course, first cells in colony. When you grow the colony and make that look like bacteria. So you have to do differentiate between one another. You have to do biochemical reaction. Biochemical reaction. So what are the important biochemical reaction that we do in the laboratory? First one is oxidase test. So this is very important because in the as for a second MBBS examination as well as a NEET examination that will be asked. So the oxidase agent is tetramethyl paraffin diamino dihydrochloride. Tetramethyl paraffin diamino dihydrochloride. You put a colony onto it, it will change the color into purple. 1% of oxidase reagent. Okay, oxidase. So Enterobacteriaceae are all enteric organisms are oxidase negative. Oxidase negative. If you are a very bright, if you want to score distinction, you remember pinch. This is pinch. Okay. This is Pseudomonas. All Enterobacteriaceae are gram negative. Nocardia, Neisseria. Cholera bacilli. Helicobacter. Remember, all these are pinch, mnemonic pinch. All Enterobacteriaceae are negative, oxidase negative. Next is catalase test, although it's not relevant, but we usually do catalase test. Take a suspension of organism, put hydrogen peroxide, there will be bubbling. This is converted into H2O2 is converted into H2O and water, oxygen and water. Then oxygen gives bubbling. This is to differentiate between Staphylococci and Streptococci. Streptococci and Streptococci. So remember Staphylococci with two C's. Catalase positive and coagulase positive. Catalase positive and coagulase positive. Oxidase test, catalase test. Okay. Then we do what is called as Cbme test. This is also asked as a 5 marks question in your final examination. Cbme, we regularly used to ask earlier. What is Cbme test? Cbme test stands for indole, methyl red, oaks proscus, citrate. Oaks proscus and citrate. Again, all this come as a spotter. In 1 marks question in the practicals, they will come as a spotter. Indole, ability of organism to convert amino acid tryptophan into gas indole. You have to grow the organism in peptone water overnight. Add coax or Ehrlich reagent. Ehrlich reagent will be pink color. MRBP reagents, detection of intermediate product acetone. Here acid, complete formation of Oaks proscus. Then citrate, ability of organism to utilize citrate. Coacer is liquid medium, cements is a solid medium. Change in the color. MR is methyl red test, is acid formation after the carbohydrate presentation. BP is acetyl methyl carbinol. Citrate, ability of organism to utilize carbon as the only source and solely source of carbon. These are called Cbme test. So E. coli plus minus Klebsiella minus plus. These are very important question that is asked in your exam. Cbme comes as a short note. McConkey comes as a short note. and organism causing urinary tract infection comes as that route. Collection of the urine, midstream sample of urine. First few drops should be avoided. Second few drops of the urine should be avoided. Only middle part should be processed. Thank you very much. Tomorrow we'll continue. All the best for your pharmacology examination. You have to not bunk the class and take the exam. It's not bad. Very bad. You have to read in the morning. Not ideal to sit